their back so they don't have to bother turning again. Some of our residents may have folds or wrinkles in their skin in the labia area that we will need to gently spread apart with our hand so that we cleanse all of the urine and fecal matter. When cleansing a male resident that has been incontinent of urine and feces, again, similar technique is used, and that as much of the fecal matter is removed with the diaper. Special attention must be paid on male residents to ensure that the entire scrotal area has been well cleansed. It's very easy for a resident to develop a rash if all of the fecal matter and urine has not been removed. Gently cleanse with the wipes, rinse, and pat dry. Rinse and pat the area dry well and apply the fresh brief. It will be noted that some residents may use wipes that do not require rinsing. Always follow your facility protocol. Dispose of all soiled materials appropriately. Let's remember these tips when providing perineal care. Number 1, follow the resident-specific instructions for cleansing. Number 2, remove as much fecal matter as possible with a soiled diaper. Number 3, cleanse the entire genital area, especially in between the folds of skin. Number 4, rinse if necessary and pat dry. Number 5, apply lotions or barrier creams as ordered by the resident's medical professional. Number 6, report any redness, rashes, or changes in the resident's skin immediately to your supervisor. We want to plan for the resident's first meal. Mealtime is a very enjoyable experience for the residents if they have the right table mates and they're comfortable in the dining room. So we'll want to think about number 1, physical access. If the resident's going to be using a walker or be brought to the table in a wheelchair, we're going to want to make sure we've selected a table that the resident can easily be wheeled right up to. Now also we're going to want to think about lighting and temperature. As any large dining room, there tend to be areas that are a little warmer and a little cooler. So we'll want to know the resident's preferences to make sure we pick just the right spot. Also, we will want to think about table mates. We want the resident to be able to dine with other residents that have similar interests. Some of the residents we care for will require assistance with feeding. For some residents, it's very minimal assistance. Simply cutting up their food, explaining the food that is on the plate, and so forth. Other residents, however, may need to be fully fed. Here are some important tips to consider when feeding a resident. Number 1, always sit down with the resident so they feel very comfortable. Number 2, explain what foods are on the plate. Ask the resident how they like to eat their food. For example, some people like a bite of meat with the mashed potatoes. Others want each food consumed separately. Number 3, if the resident wears dentures, always have them in place before coming to the dining room table. Number 4, make pleasant conversation so the resident feels relaxed and comfortable while enjoying the meal. Number 5, when feeding the resident, be cautious not to put too much food on each fork or spoonful. Gauge the amount according to how the resident is consuming the food. Number 6, do not rush the resident. You will need to watch that the resident is actually swallowing the food and it is not building up in the cheek of the mouth. When brushing a resident's teeth, never put your finger in their mouth unnecessarily. Always make sure that you are following your good standard precautions with hand washing and gloving. When brushing the resident's teeth, use gentle up and down motions. When cleansing the teeth in the back of the mouth, be very careful that you move in an extra gentle manner so that the toothbrush doesn't cause the resident to gag. Encourage the resident to rinse their mouth thoroughly. Some of our residents wear dentures. Always fill the basin with water and place a washcloth in the bottom of the basin so that if the denture slips out of your hand, the denture will not break. You have learned many new skills today. As you begin to practice these skills, you will always want to have your supervisor close by to monitor your performance. Ask lots of questions. That's how you'll learn better. When you are ready to provide care independently, again, never provide care that you do not feel confident you can carry out in a safe and effective manner. Much success to you.